Hello, my name is Jillian Balach, and I'm going to be talking about obstructive lung diseases. And the two diseases that I'm going to be kind of talking about and comparing are COPD and cystic fibrosis. So I'm going to be starting talking off with COPD. COPD, which stands for chronic obstructive pulmonary disease, is kind of like an umbrella term for other infections that cause damage to your lung and cause it to become inflamed. And the two most common contributors to COPD are chronic bronchitis and emphysema. And patients that have developed this disease have either been exposed to irritant gases or fumes, air pollutants, and most commonly known as tobacco smoking. That's probably the main contributor. But for people who work in the car industry or factories that are in there smelling all the air pollutants like that, are at highest risk to developing this disease. Now, the etiology, COPD is caused by exposures to pollutants or gases, most commonly tobacco smoking. And over here, I have a picture of what normal lung tissue looks like. And as you can see here, this is lung tissue with a patient who has emphysema. And you can tell just right away that it's more swollen and inflamed because everything is more compact together. And those little air sacs are not as round and are abnormally shaped. But in a healthy lung, the bronchial tubes and air sacs are very elastic. This helps with expanding and contracting when you're breathing, and this actually helps with oxygen and pushing the air through your body. Now, with COPD, the bronchial tubes and air sacs, they actually start losing their elasticity, and this causes their lungs to not be able to expand properly like they would in a normal person who has healthy lungs. And this actually causes air to get trapped within those air sacs and be left behind. And this causes problems all around because you will feel chest pain sometimes. The oxygen in there, it actually will start to kind of kill the lung tissue and cause damage because these air sacs get stretched out and lose their elasticity, and then they don't function properly, and you can never get that function back. So lung damage that's done by COPD is not reversible, and that's what sucks about this disease because there isn't a cure for it yet. Anyone can be affected by this disease. It's more commonly found in people who smoke, like I said, work in factories that or just are always at risk to air pollutants and fumes. These gases and stuff that you breathe in can actually cause a lot of damage on your lungs. Diagnosis. So how doctors go about diagnosing COPD is they'll run a bunch of tests. Unfortunately, this disease is misdiagnosed, and it's very common to be misdiagnosed. A lot of times doctors will think you'll have COPD when it could actually be something that's not as extreme, I guess I could say. I find that kind of crazy to think that they misdiagnose this, but that's just what I read up on and my sources told me. But I guess I could see how it could be tricky to diagnose because a lot of lung diseases kind of have the same symptoms, effects on the body, and that kind of thing. So it could be tricky. But what they'll do is they'll do lung pulmonary function tests, and this is just to see how well your lungs can actually function, breathing and exhaling. So they'll look at how far your lungs will expand and that type of thing. Chest x-rays and CT scans. They'll use these tests because they can actually get a good look at how to see if your lungs are actually inflamed or what's going on. Because if there's a sign of inflammation in your lungs, that's very abnormal, and that is a great indicator that you have something going on that shouldn't be there. Arterial blood gas analysis. I thought this test was kind of cool because they actually measure the amount of oxygen that you breathe in, and that that flows throughout your whole body. And so if your levels are abnormally low, this is actually a great indicator that you could have COPD because, like I said, the oxygen will actually get stuck in those little air sacs, so you won't be able to exhale, and the oxygen won't be able to move freely through your body as well because they get stuck in the lungs. Treatments for this disease, like I said, any lung damage that's done with COPD tends to not be able to be fixed. But there are things you can do to help prolong and slow down the progression of COPD. And those things are like stop smoking right away, because that's only going to irritate your lungs more and cause even more severe problems. And that can actually increase this diagnosis and the span of your lungs. It's going to be affected greatly if you continue to do what's damaging your lungs in the first place. A lot of medicines kind of do the same thing. Bronchodilators is usually what you take in an inhaler, and what this medicine does is it helps to reduce inflammation and relax your muscles around the tubes, and that way you won't feel pain and they won't keep inflaming and ruining the tissues in your lungs. Inhaled steroids and oral steroids are kind of the same thing. Some of these actually help to free up mucus that actually might get stuck within your lungs because of the air and the sacs not working right. Lung therapy, doctors will help you to control your breathing. And if you learn how to control your breathing, the days that you're not feeling so good and feel very short of breath, this can really help, because if you control this, then your lungs won't be as inflamed and working as harder than they already are, I should say. And again, surgery can be done. It's not a common thing to have for this disease, but it can be done. There's a lot of complications that can go with surgery for people with COPD. But typically people get on medicine or even be put on oxygen therapy is another way that kind of help them manage this disease, and actually can live quite a long time coping and managing this disease. So the prognosis for COPD, like I said, COPD is not curable yet, but you can still manage to have a longer life that's very comfortable, and you're still able to do things. My grandma had COPD for, I think, 20 plus years, and she still managed to move around and kind of cope with it. So it is possible. And I don't think a lot of people realize that. But the key factor to preventing COPD is not smoking. That is the main, that's pretty much the only way you can prevent this disease from coming about. And obviously it's hard if you're in a workplace that has a lot of fumes in the air or air pollutants that you're always around every single day. So wearing a mask or something like that can help reduce the risk to being affected by COPD. Complications include developing other respiratory infections. People who tend to have COPD sometimes will get infections like pneumonia that will really, symptoms will really increase with that, and you'll have a lot of trouble breathing. And actually this can be a deadly thing to have when you have COPD. Heart problems, a lot of people develop heart problems with COPD because they're not getting enough oxygen and their lungs aren't working right, so then their heart has to overpower that and try to help, and that ends up just not working out. Lung cancer, people with COPD are at higher risk to lung cancer. High blood pressure in the lung arteries, and depression. Depression's kind of a different one, but people who tend to have COPD think their life, tend to think that they can't live with this disease, so they go into depression because obviously they want to try to treat it and cure it, and it's not curable, but it's a very manageable disease that you can live with. So that's kind of a good thing about this disease, is that it can be managed. Follow-up care, there are things you can do to help slow progression of this disease, and those things are obviously quitting smoking, eating healthy so you're getting the nutrients your body needs to help kind of fight this off and help with inflammation, and so you're not getting malnourished. Controlled breathing will help, like I said. On days you're feeling very short of breath, it helps to be able to control your breathing so you know you're getting enough oxygen. And of course, seeing the doctor regularly. If you're having any complications or just feeling very fatigued, that kind of thing, that will help. So your doctor can kind of stay up to date and you can keep up with your medications and that kind of thing. So moving to cystic fibrosis, Cystic fibrosis is different than COPD because this is an inherited disease. It's an inherited disorder that affects the lungs, digestive system, and other organs in the body. Basically, this disease is the cells that produce mucus, sweat, and digestive juices are affected by this defective gene. And what happens is normally these secretions are thin and slippery and kind of act as a lubricant and that kind of thing within your organs and your body. But with cystic fibrosis, this disease or this secretions actually turn to be thick and sticky. And instead of acting as a lubricant, they start to plug up your ducts, passageway, and tubes, that kind of thing. And that causes a lot of problems within your whole body system because if things are plugged up, then they'll start to not work properly. The etiology for cystic fibrosis, also known as CF, is caused by mutation in the gene in which changes the protein that regulates salt moving in and out of your body. And this is what causes the secretions to turn to that thick and sticky substances instead of the thin and slippery. And what I didn't know is that the type of gene mutation contributes to the severity of the patient's condition. I thought if you have just that genetic mutation, then you have cystic fibrosis and you have all the same symptoms, signs, and that kind of thing, but that's not the case. I guess depending on the severity of the gene mutation itself contributes to the condition of your case, I guess. It's an inherited gene that is more commonly found in children in the European white descent. It has been found obviously in other races, ages, and that kind of thing, but that's what it's most commonly found as. The main risk factor is having parents that carry this mutated gene. Sometimes people don't know whether they have it or not, so it's always good to know your family history, if anyone has had it before, or your partner's family history. And that way, if you're deciding you want to have kids or that kind of thing, you can kind of talk to someone about it and kind of know what the precautions are and what could happen. Diagnosis for CF. It's an inherited disease, so doctors will do multiple screenings tests on a patient. Most commonly done on newborns that are at risk to this disease. Now signs and symptoms cannot show for a few, and it can be in more younger children instead of newborns, but typically they do and run genetic testing on newborns and blood tests. And what they'll do is they'll look for a higher than normal level of the IRT chemical, which is released by the pancreas. So by doing a blood test, they can help see this. But the thing with newborns is sometimes the stress of being birthed itself will cause a higher level. So that's why they'll have to do genetic screening and blood testing just to make sure that's the cause and it's not just because of the stress of birth. Treatments for COPD. There's no cure for it. There's medications that can help break up mucus that you can cough up so that your lungs aren't as plugged or your tubes. Chest physical therapy is another thing. Pulmonary rehabilitation. This is more so controlled breathing and kind of working out your lungs, I should say. And surgery in some cases, because some side effects of cystic fibrosis are nasal polyps. And so what they'll do is they'll remove those so you're able to breathe better, and there's nothing obstructing your passageways for your airflow. Prognosis for CF. Depending on the severity of the patient's condition, they can manage life with this disease for a while. Unfortunately, there's still no cure for it. So the progression of this disease is always continuous, but there are ways that you can obviously try to slow it down and kind of manage it. Like I said, there is no prevention for this disease because it is a genetic disorder. Complications include damaged airways, chronic infections, nasal polyps, pneumothorax, respiratory failure, and acute exacerbations. And that is what it also has in common with COPD is they both have acute exacerbations, and this causes chest pains and all that kind of thing. So patients can learn how to deal and try to minimize acute exacerbations. Follow-up care. Cystic fibrosis can help be managed by taking some precautions and developing a healthier lifestyle. Healthy diet's a main factor. People with cystic fibrosis need a higher calorie intake because they could be at risk for malnutrition because the digestive enzymes can't digest food well, so you're not going to actually get the nutrients in that food you're eating. Drinking lots of fluid, exercising, Staying up to date on your immunizations is kind of a key thing to do also with cystic fibrosis. I know there's a lot of controversy with vaccines and that type of thing, but when your immune system is down like that anyways, and you're having trouble to fight off like other infections and that kind of thing, I think I can see why it's important to stay up on that. They also said washing your hands a lot was, and I thought that was kind of funny because like it's so true. But it just was funny how they had that as a tip on more than one source that I read to like do research on this. So I thought that was kind of cool. So with having done research on both of these diseases, I've actually realized that they do both have a lot of similarities, but they also have a lot of differences. And I think it's kind of cool. Cool in a way of all the similarities that they do have. Like they have a lot of the same symptoms like shortness of breath, obstructive passageways, damage to lung airways, tubes, ducts, affecting other organ systems in your body. Just all those different symptoms that are the same. So I can see why it's like hard to kind of diagnose right away what lung disease or lung problems you are having, because there are some key differences that doctors look for, and so I can see why it can be a hard thing and is misdiagnosed quite a bit. And like some of the differences, like CF gives off a different chemical that's released from your pancreas, so if that's abnormally high, then that can be a great indicator that you have this disease. Whereas COPD doesn't do that. It takes more account into how much oxygen is actually getting into your body and how well you can inhale and exhale. It's just very cool to see the differences and similarities to these two diseases that are very common in the United States or just overall around the world. And it's just kind of cool to see like what affects what you're doing to get COPD if you're at a risk for that, or if you're at risk for CF, which obviously is kind of different because it's an inherited disorder. I just thought it was really cool to be able to get to see the differences that these two diseases had when in reality there's so many similarities between the two. Thank you.